if I'm showing empathy or compassion to you, you have to trust me. You have to believe in me. And that comes by my very first pillar, which I say is non-negotiable, but it's integrity.
Why do we have such a problem with empathy, particularly in leadership positions?
I think because people don't understand it and they're afraid to get involved.
How do you separate management from leadership?
The line is very thin. I look at a leader as the visionary. I look as the manager as the tactical application. And so
As a leader, what do you do? How do you keep people engaged? How do you keep people doing this job?
whether you're in the hospital side, the payer side, or provider practice side, there's a lot of negative stuff going on between.
How do you coach leaders to be more open, to limit that resistance to making things more efficient?
AI was not making medical decisions. They were not making clinical decisions. They started with the back office, the business side of the business, and applied AI to some of their processes to make them.
Hey there, and welcome to Healthcare Journeys, where we bring you stories from across the healthcare landscape, chronicling personal and professional journeys that shape the industry. My name is Kevin Rosenquist. I am your host. Thank you for being here.
This podcast is brought to you by S2M Health, a trusted partner for U.S. healthcare payers and providers. From accurate risk adjustment coding to full spectrum RCM services, S2M Health combines clinical expertise with precision operations to drive better outcomes across the healthcare ecosystem.
Leadership can make or break healthcare organizations, from hospitals and startups to payers and providers. My guest today is Jim Carlough, a seasoned strategist, speaker, and author of The 6 Pillars of Effective Leadership, a roadmap to success. With over 30 years of experience driving growth and transformation in healthcare, Jim has built a reputation for developing high-performing teams, reviving underperforming organizations, and guiding leaders through change. Jim, welcome.
Kevin, I'm excited to be here. Another healthcare junkie like myself. This is going to be a fun conversation.
Absolutely. Absolutely. And I'm really excited to talk about some of your ideas on leadership and the like, because I think it's really an interesting conversation. You know, we'll talk about born leaders versus made leaders and things like that. But I want to start here. Your philosophy, to that point, challenges the idea that leaders are born, not made. How do you help people, especially, in healthcare, since we're a healthcare show, how do you help them shift from doubting leadership ability to embracing it as a skill that they can work on and grow?
So the common thing that I've seen as I've mentored people the last 25 years is we have a habit in this country, and probably even further abroad. We see an individual contributor who does a great job, and we tap them on the shoulder and say, hey, we want to put you in management. And they thrust somebody in management, and they've not given them a roadmap to follow. Mm-hmm. And so what I have learned over the last 25 years is a lot of the characteristics of the human side of leadership is missing. And I think those aspects of it are very important to have if you're going to be successful.
What do you mean by human aspects?
So when I think of humanizing leadership, it's showing compassion and showing empathy as starters, mm-hmm. right? But before that, in order for me to be believable, if I'm showing empathy or compassion to you, you have to trust me. You have to believe in me. And that comes by my very first pillar, which I say is non-negotiable, but it's integrity. Mm-hmm. Integrity and transparency. I learned many, many years ago that if you're not going to drive down, I'm going to use the analogy of the center of the road, not that you're going to drive across the double line, but
you shouldn't,
Correct. But for me, the integrity means you're going to drive that straight path, and you're not going to vary and go one way or the other. And I learned this ironically, the year I graduated college, which was 1983. Now I'm dating myself. That year, after I graduated, I ran for a local city election as a city councilman in a small town in New Jersey.
Wow. At like 22, 23.
Yes, and I won.
Wow.
And I was reelected 3 years later, but shortly after that first election, the city manager called me and he said, "Hey, can you come spend a few minutes with me?" And in 1983, there weren't cell phones, right? So, I mean, this literally was a phone call attached to the wall. And I went and I sat down with him and we chit-chatted for a while. And he eventually said, "Jim, I want to ask you a favor." And immediately my antennae go up because I'm hearing my first, I'm not even sworn in yet. Somebody's asking me for a favor. This can't be good, right?
Mm-hmm.
And I sat there and he said, "You're a smart guy. You're going to do really, really well. And the people have really listened to you and responded to you." He said, "But I want to ask you to do me one favor." He said, "At night, when you go to bed and you're putting your head down on the pillow, I want you to ask yourself one question. And that question is, did I do anything today for my own self-benefit that was at the expense of another individual, group of individuals, or organization?" And then he went on. He said, "If you can say no to that question, you can sleep peacefully. But if you ever say yes to that question, you need to do two things, and you need to do them right away. The first thing is figure out if you can unwind it. The second thing is figure out how to never do it again."
Mm-hmm. Interesting.
I have asked myself that question every night since November of 1983. And
Wow.
I measure myself by that one simple question. And that keeps me on that level pathway, knowing that I'm going to be consistent, that integrity is important, and that, people are going to see that day in and day out. Now, I'm not the only one who uses integrity in leadership. And so, when I think of it, I think of Satya Nadella from Microsoft. When he entered Microsoft in 2014, he made it very, very clear to everyone that integrity was going to be the center of how they were going to operate at Microsoft. And he has led them through some very challenging times. But he has done that by taking them down that roadway and ensuring that they never veer off to the left or the right.
Mm-hmm.
And I think it starts there. And if you can master that, I mean, I look at leaders that I've had in my career who I think lacked that integrity trait.
I can think of a lot. Like, to be honest with you, like as you were saying that, I could think of a lot of people who could not answer that question in a positive way before they go to bed.
Correct. And what I saw with some of those leaders is they would every year kind of reverse the seating order of the people underneath them, either move them out or move them in.
Mm-hmm.
And I dubbed that the moving of the chairs on the Titanic. The Titanic is eventually going to sink. It's just going to take some time for people to figure that out.
Mm-hmm.
And eventually that leader gets caught up in that and can't survive. And when you see CEOs turn over at a rapid pace at a specific organization, that's probably an organization that lacks that integrity kind of characteristic instilled in its organizational structure.
Mm-hmm.
And so I have led my entire career and life exactly that way. Because to me, leadership is a 24/7 job. Somebody asked me once in an interview, "So tell me, Jim, when does leadership start for you? Does it start when you get out of the car in the parking lot or when you get at your desk?" And my response was, it starts when my feet hit the floor and I get out of bed in the morning.
Yeah.
Because my family sees it, and everybody I'm going to interact with is going to see it throughout the day.
Mm-hmm. I like that. And continuing to unpack your pillars, you started with integrity. The other 5 are focus, empathy, which we touched on, compassion, humor, and stability. Which of these maybe all of them, do you find that healthcare leaders might struggle with most?
If I take the non-nursing staff and we talk just management staff, I would tell you compassion and empathy.
Wow.
And
That's
it's not,
interesting.
and it's not just in healthcare.
Yeah.
Compassion and empathy is hard to learn and understand, because that means in order for me to be able to show it, I don't have to have a PhD in psychology, but I have to be able to be attuned enough to know when Kevin walked in the door this morning, his chin was a little bit lower. Something's bothering him. Is it work related or family related, or is the dog sick at home? What is it that's different about Kevin today? And how can I help with that? And I view that as a leader as something very, very important. You don't want somebody on the front line who's not giving 100%. You don't want someone who can't commit to the goal or the vision of what you're trying to do. And the sooner you can help fix that, the better you're going to be. And I also see that as one of the biggest areas new leaders struggle with and have trouble grasping, that they actually have to try to make that personal connection with their team. You know, when I think back to my early days in the career, I remember in office buildings, the office doors were always shut. That's not the case anymore. Mm-hmm. Office doors are open. And so I think people are more welcoming today, and people are operating with more transparency. But I also think it's something that in this country, we've lost a little bit of over the last 20 plus years. And I truly believe that. I think there's been a time transition, and I don't want to get into politics, but I think we've sort of gotten away from those golden rules that our parents taught us when we were kids.
Absolutely, we have. Absolutely. And I think, you know, empathy is one of those things that I talk about a lot just in general. And there is a lack of it. I mean, you could see it everywhere, you know. I mean, I was reading a sports article just before we jumped on, and I don't know why, but every once in a while I just scroll down those comments and I just like, wow. Like, I know a lot of it is trolling, a lot of it isn't real, but you can tell some things are. And there is a serious lack of empathy just in people in general. Do you feel that trickles up, if you will, to management and stuff like that? Or is it the reverse? Or, you know, why do we have such a problem with empathy, particularly in leadership positions?
I think because people don't understand it and they're afraid to get involved. I think people are afraid that, not that they could cause damage, because you're not going to fix anything,
sure,
but they're afraid that they may be exposing themselves or be too close to the individual as a result. And I totally disagree with that. I worked for a number of years for Perot Systems, which was run by Ross Perot. And we had a policy that if we had a team member or a team's immediate family member who was ill and in the hospital with something serious, we had to report it to Mr. Perot's office. And then we had to make sure that that individual or that family member was getting the best possible care they could get wherever they were. And if not, Mr. Perot would personally fly them to a city that would have the type of care that they needed, regardless of cost.
Wow, that's pretty cool. It's really cool.
Tell me and I'll tell you a story. I had a young man who was 28, and he had to have open heart surgery and have a valve removed. Now, this is 2002, 2003. Mm-hmm. And the young man did not want to come to Dallas Perot Systems was based here in Dallas. And he wanted to have it done in San Francisco at a university hospital close to where he lived. We were okay with all of that. So my responsibility as the leader for the area that he worked in was I had to take care of his family. So I knew that he was going to be in at least 14 days. And even though the family lived close to San Francisco, I had to offer to put them up in a hotel at our expense. And I had to make sure that they got fed 3 meals a day. So I called the hospital and spoke to the dietary area, and I said, I need to have meals sent to the ICU unit, to the waiting room, breakfast, lunch, and dinner. How do we make that happen? They said, we can't do that. And I said, no, we got to do that. And I said, if we don't do that, I got to bring caterers in 3 times a day to your ICU unit. I have an obligation to a family to take care of them. Eventually, I get a phone call from the CEO of the hospital. It's a big hospital. And he said, tell me why you want to do this. I said, I have an obligation to take care of that family. Told him who I worked for, what our mission was, why we do this, because it's important to us. And he was like, but we've never done that. We don't have a way to do it. I said, sir, with all due respect, if we can't figure out a way to do it, and I'm going to pay for the food, I'm not asking for a freebie.
Right. Yeah. You're not asking for handouts. Yeah.
Correct. But if we can't figure out a way to do it, I'm sending caterers there 3 times a day. And please don't tell me I can't. He said, I'm going to have to call you back. He goes away, calls me back 2 or 3 days later. And he said, we figured out a way to do it. And I said, okay, tell me how you want it done. I'll convey it to the family. So, and I said, and don't forget, I'm going to email you my address and everything, and I get the bill. And he said, understood. It goes off. Kid has a surgery, gets discharged. Everything's going great. About 3 months later, I realized I haven't gotten a bill. So I called the CEO's office and I get him on the phone. I told him who I was. He said, sir, I remember you. I said, well, I haven't gotten a bill for the food for the family that I fed for 2 weeks. He said, Mr. Carlough, he said, you're not going to get a bill because you taught me a very valuable lesson about how important my employees are to me. And I'm going to pay it forward. And I'm beginning by not charging you for that food. I would have never thought in my entire professional career that I had an obligation to the family members of my employees when they're sick or ill.
Wow.
And he learned a lesson from that.
Good, and a really valuable lesson too. I mean, wow, what a story. What a story. So, I mean, I think it's interesting because, you brought up before, people getting sort of, I don't know, not pushed into management, but,
Selected.
Yeah. And I'm sure offered more money and things like that. So it's really hard but maybe not giving them the tools. How do you separate management from leadership? How do you distinguish those two qualities? I mean, because you're talking about someone who was in management and learned a very valuable leadership lesson. How do you separate those and how do they come together?
So the line is very thin and the line can go either way. I look at a leader as the visionary. I look as the manager as the tactical application. And so together they need to work to ensure the safety and health of their team members. And let's face it, today in this country, we have a mental health issue. We have it worldwide.
Yeah.
But we have an obligation to take care of our employees. And I truly, truly believe that. I have 2 jobs as a leader. Number 1 is to take care of my people. And number 2 is to develop the next wave of leadership that's going to come up and follow us. That's what I view my job as a leader. Now, there's also responsibility in terms of making your numbers or achieving certain, achievements or whatever.
Growing a company, keeping it viable, all that stuff. Sure.
But if you're taking care of your people, your most valuable asset,
yeah,
they're going to follow you into battle. I'll tell you another story. I had a software team one time, and they were dealing with a claim system platform that was old green screen technology from the 90s. And we were sunsetting it and replacing it with Windows-based technology. We had 36 customers that were on this old green screen technology. So we figured it would take us 3 years to transition people to the new technology. So I had to tell this team of 25 people that their jobs were going away, but I didn't know when. But I had a responsibility to the company to make sure we supported 36 customers until they transitioned. I did not know how to handle it.
Yeah, that's a tough spot.
I had several sleepless nights. And then I finally sat down and I said, what would I want my boss to say to me if he was going to tell me my job was going away? So I met with them as a group. I made 3 promises to them. My sole goal was to have enough people stay and not jump ship to take care of every customer till they transitioned. The first promise I made was that if they wanted, anybody in the team wanted to learn the new products and services and technologies we were introducing, that I would make available the training during the workday, not at night, not early morning, during the workday. That was promise number 1. Promise number 2, if you wanted to stay with the company at the point in time you would transition, I will do everything in my power to find you a job within the company. Third thing I promised them is you will know the moment I know the date at which you will be impacted based on the implementation time schedule for every single client. So you'll know the time, you'll know the pathway forward, and the minimum amount of time of notice you'd have is 6 months, because we could not implement a transition in faster than 6 months. Again, my sole goal was to keep everybody there. I succeeded in that goal. But something else happened that I never expected. About 6 months, 8 months into this, I get a call from human resources. Nobody likes a call from human resources. And they asked if they could come and visit with me. They said they could visit with me.
Oh, that's even worse.
It's even worse. They didn't walk in with an empty box, and my boss wasn't with them, so I knew it couldn't be that bad. But they sat down with me and they said, do you remember a couple months ago we did an employee satisfaction survey? I said, yes. And they said, well, we're here to talk to you about your group in California. We just don't understand what we're seeing. And I said, okay, what are you seeing? Well, we got the results of the employee satisfaction scores back, and we have 20,000 employees in the company, and these 25 are the happiest employees that we have. Why? You're downsizing them. Why aren't they jumping ship? And I looked and I smiled and I said, because I had their back. And they said, what do you mean? And I told them what I said to them, and I followed through on it, and they were mortified. In a positive way, mortified. They could not believe the impact that it had, that this group of people who knew their jobs were going away felt protected. They didn't have to go home and worry about their next job.
Right.
I never expected that to happen.
Wow. Wow. Yeah. It's funny that you brought it. I'm sure there's a lot of people listening here thinking the same thing I am. Like, man, I've never worked for a company that actually like has that mindset. I've always thought about that as far as why do more companies not realize how important employee happiness is? I remember one time telling a boss that I had, because we had this one employee who was kind of not doing great. He was in a management role and he was like wanting, he was really fired up about it. He wanted to get rid of him. And I said, well, I think we should talk to him. We should find out if he's happy. And he was just like, I don't give an F if he's happy. And I was like, I was like, wait, what? Like, that just like didn't, it was like, does not compute. I couldn't figure out how you could possibly say that. But it's interesting that I've never met, or I've never worked at a place that I would have felt what those 25 people felt. And I think that there's a lot of people, the majority of people probably could say the same thing.
They probably can. And remember, I didn't know how to deal with it.
Right. Sure.
I mean, openly admit, and I was a leader. I didn't, right. You know, every day is a new day as a leader, and you always are learning different things. And some of it may fail. Some of it may not work out right. I have been blessed and lucky at the same time to have had a lot of success, and also had a lot of good mentors that I could call upon for advice and say, have you ever been in a situation like this? And so I'm very big on mentoring, which is why I've done it the last 20 some years. And I encourage people who are listening, if you don't have a mentor who's not your boss, you should have one.
Yeah.
They're very, very helpful. It's, it doesn't necessarily need to be your spouse, but somebody that can understand your business situation, what you're in, and the challenges you may face so that you can bounce ideas off of them. We all need that.
Yeah.
I have it. I have
Absolutely.
mentors I can call upon.
Yeah. I mean, we're talking a lot about the employees and now, and this, I think, is a good segue to something I wanted to ask you about, back to healthcare teams. It's no secret healthcare teams are under enormous stress, a lot more than a lot of industries out there, certainly more than any industry I've ever worked in. You want to have accountability. You don't want to exhaust people. You want to have their backs, as you said, ideally. How do you balance all of that? You've got a lot of regulations in this industry. You don't want to burn people out. What do you, as a leader, what do you do? How do you keep people engaged? How do you keep people doing this job, this hard job?
That's a great question. In fact, I just got asked to speak at a Medicare Advantage conference that is in December on that very topic. And my framework for what I'm going to talk about that day starts with transparency.
Mm-hmm.
And there's a lot of, whether you're in the hospital side, the payer side, or provider practice side, there's a lot of negative stuff going on.
Yep.
Between the big, beautiful bill, rising risk. If you look at the states that are having trouble funding Medicaid today, California had to borrow $1 billion loan from CMS because their Medicaid risk had gone up so high.
Mm-hmm.
Look at the Medicare Advantage plans, the publicly traded ones that have had the worst year ever, and they're not making money. That's impacting departments and entire divisions of organizations. There's a lot of stress, and a lot of people need to know what's happening. And we need to be open about, okay, look, we may be under federal investigation for something, but we feel strongly that we're not, we haven't done anything wrong, or whatever it is. Or they just posted, poor financial results, and, they said, well, we're going to have to make some cuts or changes. Now the employees see that or read that the next day in the newspaper. What are you telling them about what you're doing?
Mm-hmm.
The worst thing to do is not tell them a thing.
Right.
Because you don't tell them a thing, they're updating their resume, and you're not going to have them, and you may need them.
Right.
They may be people that you think are indispensable if that was to happen. But by the time you learn about it, it's too late. They've already had an interview and they've half checked out mentally. The time to do that is before you actually give those financial results, and you talk to you don't have to tell them the financial results you're going to report to Wall Street, but you do have to tell them that we're going to be looking at doing some changes for efficiency to reduce our costs, because I see our costs going up.
Mm-hmm.
That doesn't violate any SEC rules, being honest to your employees.
Right. Right.
That's a big part of it. And so that starts with transparency and integrity. And I think the next two things that come along with that, because of all of the uncertainty, is making sure people know what you know. Now, if you work for any type of company, if the company's looking at selling a division or acquiring another company, they can't tell you about that.
Sure.
But they certainly can be open about the things and trends that they're seeing in the market, and how we as a company may need to respond to that. If people have that knowledge, they can help solve the problem, number one. But number two, they're going to feel a lot better about being engaged and understanding how we're handling the challenges. And I think all too often we hide the challenges.
We talked before we hit record. We were starting to talk about tech and AI and some of this stuff, and then we realized we should probably record, because we were having a great conversation. But I wanted to get this out here as well. I mentioned how healthcare is one of those industries that's notorious for resistance to change, to new technology, new processes, or even cultural shifts. How do you help leaders? How do you coach leaders to be more open, to limit that resistance to making things more efficient?
So as I mentioned earlier, there's a hospital system in Chicago that adopted an AI governance team that consisted people from ethics, the medical directors, all areas of the organization, including security and privacy. And they are the overarching decision makers as to what things they may do with AI. And they just announced that they have saved over $100 million in the last 12 months by the
When
use
you
of
said
AI.
that like blew my mind.
Now, it was 100. I remember the numbers because I just read it this morning. But it's a big hospital system, but I want to make sure everybody understands it. AI was not making medical decisions. They were not making clinical decisions. They started with the back office, the business side of the business, and applied AI to some of their processes to make them more efficient or to find where they had problems that they didn't know they had. And so, to me, as we talked, AI is not going to replace leadership, and it's not going to replace people, because I don't believe AI can show empathy or compassion.
Right.
And until it can, it's not going to replace people. And I think people are worried that it will. I'm not going to say that there won't be jobs impacted, but as an employee who use that AI, it'll allow you to work smarter and faster at a higher level than where you are today. Because how you're performing it today may be all manual or with spreadsheets. Now you can just push a button and push the data into an AI engine, and it's going to tell you the 5 next things you need to do. Mm-hmm. And then you can go and enact those things. So it will not replace the grand scheme of the grand population, but it could it will have a little bit of an impact, but it's not going to be as bad as I think people are worried it's going to be. And I always say, if you hear that it's going to be bad on the news, don't believe it, because they only report bad stuff.
Yeah. And they don't really know the nuances of that. I mean, everybody, especially these days when everybody wants a soundbite or a social media clip, it definitely changes things. You know, before we wrap up, and just so everybody knows, Jim's got a giveaway, so stick around. But I wanted to ask you briefly, you know, for people who are listening, who might be thinking about maybe stepping into a leadership role, maybe want to get into a leadership role, maybe have been offered a leadership or management role. What is one thing that you think they should think about that's maybe less obvious than the standard things you see from every guru and every self-help book you could think of?
I would tell you that leadership is a journey that you will get better at the more you're in it, and it will always be evolving. And it will always be evolving because the way we led or managed in the 80s is very different than the way we lead and manage today, which is much more collaborative. I once said it in an interview, I needed to go back and apologize to the first team I managed in 1983 because I was horrible.
You're terrible at it. Yeah.
I'm terrible. I didn't know what I didn't have a roadmap.
Yeah.
Somebody hired me as a manager because I was a great individual contributor, and they said, you know a lot about the business, go for it.
Yeah. I had a similar thing. I got promoted to something I was not prepared for. Yeah.
Mm-hmm. And just know it's a journey. Don't be afraid to jump in the water. The water's warm, right? There'll be good days and bad days, but I would do it all over again, just knowing the people that I have met, interacted with, and helped develop and grow, and help them grow in their own professional career, much like a teacher. So my counsel to them is, don't be afraid, find a mentor, and just start the learning process. Mm-hmm. Start with my book or any book that you can find on leadership. It's a field of thousands of books on leadership. So, but it has been a great career for me. It's been a great career for my family. My wife is also in healthcare. I've got one child in healthcare. I have 3. So it's going to carry forward in the next generation, I think.
All right. Well, speaking of your book, tell us what you're offering our listeners.
So one of the things that I would like from the listeners, and I think Kevin would as well, is feedback on what resonated with you today or what didn't. And the reason is we're learning. Now, I may have a book, but it doesn't mean I know everything. I don't pretend to be the smartest person in the room. And so we want feedback. So here's what we're going to do. Kevin's going to post this episode to YouTube, and the first 5 people who post a comment in that YouTube channel will get an autographed copy of my book.
Awesome.
It doesn't matter if it's positive or negative. We just want the feedback. Now, here's the trick to this. Please do not put your address in social media. Just your name. We will reach back out to you.
We'll find a way to get in touch with you
so that we can ship you the book, but please don't. But again, I want to give away 5 books to Kevin's audience. For the first 5, each of the first 5 people will get a signed copy of my book.
Well, that's awesome, Jim. I really appreciate that. I know our listeners do as well. So I'm hoping that we'll get this episode up soon, and then that way you can get these books out. Well, listen, I really enjoyed this conversation. It's a great topic. It's very interesting. You're clearly someone that is worth learning from. Thank you so much for being on the show. Thank you so much for mentoring people and teaching things like empathy and teaching things like compassion. So important. Really enjoyed having you on. Would love to have you on again sometime. Thank you so much for being here, Jim.
Well, thank you for having me. And for those who have listened through the whole show, thank you for being here.